When thinking about the people in our lives that we love the most, that we try our hardest to protect, and that we'd be lost without them, we tend to think of the women in our life, like our mothers, grandmothers, sisters, and daughters, and other special women that we feel the most protected over. Unfortunately, they are also the people most likely to be diagnosed with breast cancer. Well, that's what happened to me. My mom was recently diagnosed with breast cancer. I was devastated by the news. My mom is my best friend because she's the one person that I know accepts me for me and loves me unconditionally. And the thought of her not being around is overwhelming to me. Fortunately, it was detected in the early stages because my mom practiced early detection. Currently, the cause for breast cancers are not known, but the best protection is to detect it as early as possible. The purpose of this podcast is not to persuade women, but to give them the information needed so that they can make an informed decision on the importance of early detection. There are three different ways to detect breast cancer in its early stages: self breast examination, mammogram, and knowing your body. Let's start with self breast examination. A breast self examination (BSE) involves checking your breast to help detect breast problems. Many breast problems are first discovered by women themselves, often by accident. Breast lumps can be non-cancerous or cancerous. Breast cancer can occur at any age, though it's most common in women older than 50 years old, which in this case is my mom, who's 83 years old. The benefits of the self-breast exam: it teaches women to become familiar with the normal consistency of their breast and the underlying tissue. It makes it easier for women to notice subtle but potential serious changes. The changes may become apparent quickly or over the course of time. Now, the second way to detect breast cancer in its earliest stage is a mammogram. A mammogram is a test that reveals the inner breast tissue on an X-ray film. It is a test used to screen for abnormal changes, including cancer of the breast. This test can detect tiny tumors that cannot be felt or would not have been detected. Mammograms don't prevent breast cancer, but they can save lives by finding breast cancer as early as possible. Mammograms have shown to lower the risk of dying from breast cancer. Now, the third way to detect breast cancer in its early stage is simple: knowing your body. I feel this is the most important compared to the other two. It's important for a woman to become familiar with her breast, but it's just as important for a woman to know her body. Knowing what is normal and what isn't. To know what her body is telling her and knowing what is going on with her body. To know what's causing certain things in her body to react to. A woman's body lets her know that something's going on. Don't ignore what your body's telling you, because ignoring your body signs and not listening, not paying attention to crucial things may lead to disaster, disease, and the point of no return. In summary, I learned some interesting facts about breast cancer, which I felt I should pass along. I learned breast cancer is the most common cancer among women. The chances of a woman having breast cancer sometime during her life is 1 in 8. But early detection is the key in the treatment of breast cancer. The best detection method is to use all three: self-breast exam, mammograms, and knowing your body together. All three helped my mom in catching her cancer at its earliest stage. She was lucky. The cancer was situated in one area of the breast, and it was small in size. which means they can treat the area by removing the tumor and treating the area with radiation during surgery. And she doesn't have to lose her breast. Currently, finding out that you or your loved one has breast cancer is a horrifying experience. But no longer does it mean your life or their life is at an end. Well, I hope that this information proves helpful to you. By no means am a professional on breast cancer. I'm simply sharing the importance of detecting breast cancer early and some simple steps that might save a life. Together, we can educate all the special women in our lives. So with that, I'd like to leave you with this question. What have you done to prevent breast cancer?